Thank you very much, everybody. Thank you. So, America continues to wage all-out war to defeat the virus, this horrible, horrible virus. You see how terrible it is, especially when you look at the numbers from yesterday. And we explained why we're extending our nationwide guidelines to slow the spread for 30 days. Together, we have the power to save countless lives. We're attacking the virus on every front with social distancing, economic support for our workers, rapid medical intervention, and very serious innovation, and banning dangerous foreign travel that threatens the health of our people. And we did that early, far earlier than anyone would have thought, and way ahead of anybody else. In this time of need, I know that every American will do their patriotic duty and help us to achieve a total victory. As governments and nations focus on the coronavirus, there's a growing threat that cartels, criminals, terrorists, and other malign actors will try to exploit the situation for their own gain, and we must not let that happen. We will never let that happen. We're deploying additional Navy destroyers, combat ships, aircraft and helicopters, Coast Guard cutters, and Air Force surveillance aircraft, doubling our capabilities in the region.
Mr. President?
Is this concerning the gentleman, or do you want them? You don't want them to get back to work and capture all those bad people?
A follow-up, Mr. President, or Mr.
Sure.
Secretary.
Capture all those bad people.
A follow-up, Mr. President, or Mr.
Sure.
Secretary.
And I just want to give you a quote here from Professor Walter Ricciardi, a scientific advisor to Italy's Ministry of Health. Wait for this in terms of, and in relation to what I've said. The way in which we code deaths in our country is very generous in the sense that all the people who die in hospitals with the coronavirus are deemed to be dying of coronavirus. Hello? On re-evaluation by the Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have had at least one premorbidity. Many had two or three. Yes, 99% of people who are said to have died from coronavirus, COVID-19, in Italy have had 1, 2, 3, or more other health problems. And the scam is that when they die from those other health problems and test for COVID-19, a genetic material reflecting a natural immune system response, in this case, they are said to have died from COVID-19. And every time the figures go up, they frighten the shit out of people all over the world that it could be them next. So this is why, Gaz, that the death figures have not gone up to explain deaths from so-called COVID-19. It's because what's happening is people are dying of what they've always died of, but it's being redesignated that they've died of COVID-19, and that's where the figures are coming from. Now, this is why, as you've posted all week on the site, that people are going out with their phone cameras to hospitals, which are being described in the mainstream media, liars, as war zones, and they're finding nobody there. Because people aren't going to hospital because, oh, there's a coronavirus crisis. Hospital operations are being cancelled. Hospital visits for consultancies are being cancelled. And how many people are dying because of that? And so not only are they not overflowing with coronavirus patients, all these other things that normally happen at hospitals have been cancelled, and that's why they're freaking empty when people go there. So it's a scam, and it's being done by manipulating the figures and manipulating what COVID-19 really is, which is basically a natural immune response called exosomes.
I think the most simple question I would ask, which would back up what you've said in terms of Italy, is they've been in lockdown now for weeks and weeks, way over the 2-week incubation period that we're told this COVID-19 has. So why are the numbers going up? Do you know what I mean? If it's legitimate, why are they still going up?
That's a fantastic question, and it can be explained. The numbers will go up, lockdown or no lockdown, as long as they're testing for a genetic material that can be found in vast numbers of people that is caused by a long list of other things. And the more that the cells become toxic because of 5G, we'll come to that, but also because of other reasons like stress and fear and crap food, the more the cells will secrete the immune protection system of exosomes, and the more people will test for COVID-19, which is increasingly demonstrably just exosomes being renamed COVID-19. And it means this, that as long as they keep doing this, they can keep saying the cases have gone up, the number of people who've died have gone up, so they can go on justifying the house arrest of billions of people.
Is this concerning the gentleman, or do you want them, you don't want them to get back to work and capture all those bad people?
A follow-up, Mr. President.